Hi, welcome to Arnold Hearing Centres for another video on what to expect when getting a hearing test. Now, a few things you'll have to bring when coming in for a hearing test. First would be a valid health card, and second is a good attitude. Now, there are many outcomes to a hearing test, and when you do come into the office, you might not get the outcome that you were expecting, and that's okay. So come in with an open mindset and have an open conversation with your practitioner. Now, the first step in a hearing appointment is doing an intake form. Now, at any clinic that you go to, there'll be a difference in variety of questions that they ask, but ultimately all leading to the same thing. We just want to get to know you. So to begin, we're looking at the ear canal, and what we're looking for is any wax buildup or anything that could give us an artificial result during the hearing test. Now, for the second test that we perform, it's the pressure test, which measures to see if there's any abnormal pressure within the middle ear canal, which again could give us artificial results during our hearing test. Now, the objective of doing a hearing test is to measure the three components of your ear: the outer ear, the middle ear, and then the inner ear. Now, for the last portion of the hearing assessment, we will be conducting 2 tone tests and 2 speech tests. Now, the 2 tone tests are to measure the softest that you could hear for different ranges of speech. And the speech tests are used to measure the pathway to the brain. Now that the hearing assessment has been completed, you'll sit down with your hearing practitioner to go over the results. And remember, you should never feel obligated to move forward with a recommendation that you don't feel comfortable with. And here at Arnold Hearing Centres, we strive to create a safe, pressure-free environment for you to make the right decisions by giving you sound advice.